Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, I'm going to have a conversation with returning guest, award-winning author, speaker, and international health advocate, Silvie Beljanski. She's joining us to talk about, a few tips on strengthening immunity and obtaining wellness balance. She's also going to talk a little bit about her views on COVID-19 as an environmental toxin. Welcome back to Health Professional Radio. Silvie, how have you been?
I'm wonderful. Thank you. And thank you for having me back. It's always a pleasure.
Great. It's been a while. We talked about your book last time when you were here, the War on Cancer, that book. We talked about that. Now we are in the middle. Well, maybe not even the middle. Some of us think that this is just the beginning of this COVID-19 pandemic. Give our listeners a brief background. I said you're an award-winning author, speaker, international health advocate. For our listeners who may not be familiar with you when you were here before, give us a little bit of background.
Oh, sure. A little bit is a little bit difficult.
That's hard to do. Yeah.
I'm a lawyer, French lawyer by trade. I came to the States after my father was a scientist at the Pasteur Institute in Paris, was persecuted by the French government for finding a natural approach to cancer that actually helped former President François Mitterrand to finish his second term. And after Mitterrand finally passed away, there was some kind of political backlash, of course. And my father and his research were completely destroyed by the French army. They sent a SWAT team to ransack his laboratory. Mm-hmm. And as a lawyer at the time, I felt really shocked by what I saw, what I discovered by this brutality. And I decided to understand, to get to the bottom of it, first to help my parents with their legal defense. And then I was, captivated by the bug, of understanding. And that's how that led me to become a health advocate for integrative medicine and natural approach to cancer and to other degenerative disease. And since my father passed away, I've been here in New York and have founded a non-for-profit organization called the Ben Jackey Foundation. Mm-hmm. And we are doing research, doing partnerships with academic institutions. We have been working with Columbia University, with Kansas University Medical Center. We also had the privilege to have a clinical trial held at Cancer Treatment Centers of America. Mm-hmm. And we are testing natural compounds on different kind of cancer and different stages of cancer. And everything we are doing is getting published in peer-reviewed papers. And we are sharing this information because we believe that can make a difference for people who are seeking a natural approach to cancer.
It seems that daily we're hearing less and less about cancer and more about the COVID-19 pandemic and what to do within that pandemic. Cancer is still going on. All of the other diseases are still going on.
Yeah, you're absolutely right. Cancer has not disappeared because it's not, except from the headlines. Mm-hmm. But if you compare the numbers, we had in 2017 globally, we had 6 million people died of cancer, and we are here, globally in this COVID with 500,000. So it's kind of, two completely different approach, but mm-hmm. that are absolutely not justified by the number. To me, it is clear that there is suddenly much more money to be done, mm-hmm. To be made with some vaccination on the virus. And everybody is looking at the same thing at the same time when they have given up in many ways the war on cancer.
Well, it does certainly seem that way. Is the approach that you have to cancer research and cancer treatment similar to this COVID-19 outbreak? Are there answers within that research that may help what's going on within this research?
Indeed, one of the molecules my father was working with, it's named Paupera. It's coming from the bark of a tree of South America. He studied that the anti-cancer, but also antiviral properties of this bark. Started in the 70s, first on plants, and then on mice, and then came the 80s and AIDS. And there was, at the beginning, there was nothing to help people who were suffering a bit contaminated by the HIV virus. So some people came to him saying, I need whatever you have because I'm dying with AIDS and my doctor has nothing to offer me, but he told me that you are doing some research and you have some good results with mice, so please give me something. And my father started to help a number of people, and it has helped a number of people suffering from AIDS in the 80s. There was a clinical trial which was done in France and showed the results were extremely promising, but it was, the government was not going to get involved into something natural. So it was crushed and, nobody looked at that seriously. Mm-hmm. And then nothing really happened after that. There was no really research done on viruses. But recently, we did receive at the foundation a few testimonials of people, some being have been diagnosed with COVID and some not, but saying that they were suffering from symptoms of sore throat, the extreme fatigue, some fever, and so on. And they took the extract and they felt better quickly thereafter.
Do you think that strengthening our immune system, you're a huge advocate of strengthening the immune system to fight off all different types of maladies. Is that another key in preventing or at least recovering successfully from a COVID-19 diagnosis?
Absolutely. You want your immune system to ward off the enemy, to keep it at bay. Actually, if your immune system is strong enough to not allow the virus to take hold in your cells, then you don't need to have an antiviral product. You will just not get sick, or you will not have even any symptom if some virus was able to get into some cells. But the idea, of course, is to have the best immune system as possible, as strong as possible, and not to get sick in the first place. I know that there are a lot of, things that are being spoken about right now. Ranging from vitamin C to elderberry to a number of things that are being used to strengthen the immune system. And it's all good. Don't take just too much of one thing because that could create an imbalance. But eating healthy and taking good care of you and of your immune system, of course, is the first thing to do.
Silvie, where can our listeners get some more information about you, about your publications, about your foundation, and about your views on COVID-19 and possibly what to expect in a second wave if it hits?
So the foundation, Beljanski.org, BELJANSKI.org, all about the research, my blog about the virus, and all the story about the cancer, information on cancer, and the suppression of research by the French government is in my book, Winning the War on Cancer, and more information at winningthewaroncancer.com.
Silvie, always a pleasure. Thank you so much for coming back with us this evening on Health Professional Radio. And I'm hoping that we'll talk again soon.
Thank you so much. Looking forward to it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Silvie Beljanski. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com Health Professional Radio.